Good afternoon, everybody. Today we are going to talk about related disorders and how they may be related to autism. In my many years of working with children on the autism spectrum, I have come to believe that any social development or learning disorder that isn't exactly ordinary may share some of the underlying causes of autism. Now, we don't know exactly what these causes are, but some of the standard treatments are the same. There may be different development and behavior disorders, practically all which are also seen in autism. For example, most children with autism have some element of sensory processing disorder, obsessive compulsive disorder, language processing disorder, and ADHD, and many other ones. Now, on the other hand, we can see kids that have SPD, OCD, or a language processing problem, but they do not have autism. Now, most of the therapies are connected because these disorders are intertwined. So a child with SPD needs to go and have occupational therapy. A child with a language disorder needs to go and have speech. A child with ADD may need to go and have behavior therapy. So all of the therapies and disorders seem to be intertwined in some way. Now, when we discover what the underlying causes of all these problems are, we will probably find that they are all the same. Now, I'm going to go in and talk about sensory processing disorder. It is very important for you as a parent to recognize this disorder and begin therapy for it. For if your child has sensory problems, this is really, really important. A baby or a child with SPD does not process sensations correctly. Hearing, touch, balance are the three sensations that are most affected. When a child detects a sensation, the brain is not processing that input and in turn doesn't know how to create the natural responses to it. Like, for example, the scratchy feel of a clothing tag. This can usually be ignored by a typical child. The local sensory nerves of the skin will stop registering the scratchiness after some time. But with a child with SPD, the child will keep feeling that scratchiness and the sensory impulse will increase and get worse and worse, not like the typical child. The typical child, it will stop. But with the child with SPD, it just keeps getting worse and worse until the child either has a meltdown or they take off the shirt. Now, when a typical child enters a loud and chaotic room with lots of children, the ears actually will turn down the volume so the child's hearing center of the brain isn't overloaded. Now, this does not happen with a child that has sensory processing disorder. In this case of a child with SPD, the brain keeps hearing all the noises and the background noise and the chaos, and the child just gets really overwhelmed to the point that the child will either roll down screaming, putting his hands over his ears and whatnot, because the background noise isn't going lower. It is getting louder and louder, and sometimes they can't even hear what you are saying. These and other situations overload the child's sensory system. This in turn will prevent other areas of the brain such as the ones that control social behavior, language, and learning from developing in the right way. Or eventually, this will affect the child's ability to cope and interact with the world around him. Now, I'm going to just describe how the symptoms of SPD may occur during various ages so that you can recognize it and get it treated early. Now, symptoms during early infancy: colic, okay? Abnormal frequency of night waking. This can be from irritating clothing or irritating bedding. They don't like to be snuggled or rocked. This can be from balance or position sensitivities. Demanding to be held in only certain positions. Again, this can be balance. Need for constant motion. Now, symptoms during later infancy, say 6 to 12 months. They refuse to try foods. The refusal to try foods. This is oral sensitivity or texture sensitivity. They are uncomfortable with messiness. They don't like sticky or messy hands. They don't like a sticky face. They don't like wet clothes. They don't like getting involved in anything messy. Okay, symptoms in toddlers. Refusal to wear certain clothes. They don't feel right. Refusal to wear socks because the little bumps that you get from the laundry, they irritate their feet. Or maybe they want the socks on both legs to be exactly even. Refusal to wear shoes. Also, the inside of the shoes might be irritating for them. Refusal to walk barefoot on the grass or the sand. They don't like the feel of the grass and the sand between their toes and on the bottom of their feet. They're bothered by chaos and lots of loud noises. You might see them going like this a lot. Okay, symptoms in preschoolers. This includes everything that I just said from up. And they might be hyperactive or constantly moving. They might be fidgeting. They may have social awkwardness. Now, these are a lot of the symptoms and things that you as the parent should be aware of. If you see any of these types of symptoms, you can take your child to see a pediatrician or an occupational therapist or a psychologist. Now, thank you for joining in this module. The next module will be Module 6. It will be the first module of 2 modules about behavior therapy. The first one, we are going to discuss ABA and different types of ABA and different types of therapies that are connected with ABA. Thank you, and I hope you have a great afternoon.